Good morning, everyone. I'm so excited to be here today to talk about our education scholarship. Our education scholarship is on self-reflection in supporting residency competency acquisition. I'm Dr. Alice Kam. I'm a physiatrist, physical medicine and rehab. I really enjoy concussion education, and that's how this project started. And then subsequently, we developed a team. And today, I'm so excited to have Dr. Khan joining me for this presentation.
Thank you, Dr. Kam. Hello, everyone, and good morning. Thank you for having us here for this conference. My name is Fatima Khan, and I am a medical graduate and residency candidate in family medicine.
So for our project, we also have many team members, and we would like to acknowledge their contributions. There are many residents, as well as many family medicine practicing physicians. This project receives support from Dr. Harrison Waddington Fellowship, DFCM, at U of T. For this presentation, we would like to encourage everyone to support like discussion and dialogue at the end of the presentation. Regarding our learning objective, we have a few different learning objectives. First, we would like to take these opportunities to identify some of the ways that we can do self-reflection in postgraduate medical education. Subsequently, we're going to talk about our experience using self-reflection in supporting competency acquisition. At the end, we would like you to have an opportunity to think about your own teaching practice and how you can use self-reflection in your own practice. Show's self-reflective theories is actually a really good way to think about self-reflection. Show's really focusing on reflection in action. That means reflection during the event, as well as doing reflection after the event. That means reflection on action. On a day-to-day basis, we do reflection at the moment as well as after the event to support self-integration, knowledge translation, self-regulation, and self-monitoring. For our research study, we're focusing on implementing self-reflection in 3 different settings. One is academic half-day. Second is during clinical rotations. At the end, we ask our participants to do case logging on a monthly basis for 6 months. In order to support competency, we really focusing on this building block, starting from nose. That means like building on knowledge, subsequently application of the knowledge, and then they will get a chance to practice during their clinical setting, as well as getting coaching and feedback, really focusing on their performance. This is our study design. We invite all PGY 1 and 2's family medicine residents at U of T. And we ask them to join our academic half days. And our academic half days is using a flipped classroom case-based learning format. And the second portion of this study is about clinical rotation. For the academic half day, to support self-reflection, we have pre and post knowledge check-in. For clinical rotation, we have asked all the residents to provide us with objectives before the rotation, and as well as after the rotation, they will do a pre and post self-reflective competency survey. For a subset of participants, they will be doing case logging for 6 months. At the end, they are invited to do a self-reflective semi-structured interview to provide us in terms of their experience and their view on competency acquisition. I'm going to pass it on to Dr. Khan.
Thank you, Dr. Kam. A knowledge reflection questionnaire consisting of 18 questions about concussion assessment, management, and complication was taken by the participants pre and post academic half days. As it can be seen here that the response rate for the post academic half day was 50% as compared to that of pre academic half day. According to the feedback surveys, the participants preferred answer keys and didactic lectures as compared to the split classroom. Some participants also noted that it took them extra time to use learning resources for academic half days. All this feedback implies that the residents did not quite understand the concept of self-reflection and knowledge acquisition. They were more focused on the correct answers and marks as compared to the knowledge acquisition through self-reflection. Next, please. 10 participants completed both pre and post. Sorry, Dr. Khan. Yes, thank you. 10 participants completed both pre and post academic half-day knowledge check-in, and the paired comparison of the entire group can be seen here. As it can be seen that the two groups did not show any significant difference in terms of knowledge of concussion, which led us to the question of the significance of academic half-day settings to support knowledge application and acquisition. Next slide, please. The participants also attended concussion clinical rotation as part of the concussion curriculum with 63% of response rate for self-reflective practice. Looking at that pre and post rotation reflection, there was a positive shift in the confidence of the participants on the Likert scale of 1 to 3 out of 5 to 4 to 5 out of 5, which showed improvement in their confidence, which is an indirect measure of their competency. Next, please. During the 6-month case logging, almost all of the 5 residents had opportunities to utilize the curriculum resources like self-study guides during their clinical encounters in the ER and the outpatient clinics. This demonstrates a change in behavior following the implementation of the curriculum of concussion. At the end of the 6 months, the residents were asked about their experience in the survey feedback, and they prefer clinical workplace environment for self-reflection as compared to that of the academic half day. During the semi-structured interview, they also noted that interaction with the staff was more beneficial for competency acquisition, which supports the use of socioculture theory of competency acquisition. Dr. Kemp, over to you.
Thank you. Thank you, Dr. Khan. So in summary, what we find from our study is that residents would benefit with more orientation and education in supporting a positive learning culture for self-reflection. In addition, it seems that self-reflective practice is actually much easier to apply in a clinical context-based setting instead of academic half-day. The curriculum self-study guide seems to be able to support self-reflective practice at the end, as most of the residents ending up using the self-study guide sometimes throughout their 6 months while they're seeing other patients. Now, we would like to take a pause and let you think about your own teaching practice. In your practice, what works and what doesn't work, and how can you implement some of the self-reflection into your own teaching practice. We're going to open up for questions as well. And at the end, we also have a survey link for everyone to complete. Thank you, everyone.